Good afternoon and welcome to Webinar Wednesday. Today we are joined by Chad Holmes, Security Evangelist at Cynerio, and Dustin Smith, Executive Solution Consultant at Nuvolo. Webinar Wednesday would like to thank our sponsor Cynerio. Cynerio is the industry leader in reducing healthcare risk related to IoT, medical IoT and OT devices. The Cynerio platform provides hospitals with the control, foresight and adaptability required to stay cyber secure in a constantly evolving threatscape. Cynerio gives healthcare organizations the power to stay compliant and proactively manage every connection on their own terms with powerful asset management, threat detection, and mitigation tools so that they can focus on healthcare's top priority, delivering quality patient care. For more information, visit cynerio.com. Just a quick reminder that MD Expo is headed to Temecula Valley's Penchanka Casino and Resort next month, October the 11th to the 13th. Registration is open online at mdexposhow.com and you can use VIP code 22MDESOCAL at checkout to receive complimentary admission to this 3-day conference. The VIP code is available to individuals employed with a hospital, healthcare facility, or an active military or students. Proof of employment will be required. Okay, today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which is emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll wrap up today's presentation with a live Q&A, so please submit your question anytime using the questions feature on the webinar dashboard. Let's kick off today's webinar by giving away one of our brand new Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. Which pigment decreases in plants and leaves during fall or autumn? Answer now using the questions feature on your dashboard and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Chad Holmes and Dustin Smith are our presenters today, and they will discuss finding your phase of medical device security. Chad, you may begin whenever you're ready.
Great, thank you, Linda, and hello, everyone. Welcome to today's session, and thanks for joining. First of all, both Dustin and I are really excited for the upcoming MD Expo event that Linda just mentioned, and we hope to meet you all there. So if you have a chance, swing by the Cynerio or Nuvolo booths, and we'll be happy to chat yet more. Today, we're going to discuss the different phases of medical device security, as was mentioned earlier. I'm going to start by handing controls over to Dustin Smith from Nuvolo. Dustin's going to provide a background on the phases of operational technology and security consideration in each of these phases. Throughout the presentation, the two of us will extend the discussion to a broader range of devices, including IoT, IoMT, unmanaged devices, mobile devices, etc. We hope the session is helpful as a helpful combination of educational, informative, and instructive. So with that, Dustin, I'm going to hand it over to you.
Thanks so much, Chad. All right, so we went over really kind of brief introduction. So as Chad alluded to, we're going to go over what is OT and then kind of the different ways that we can address this, ultimately those phases. So let's kick this off. Operational technology. So what is it? Why do we care? Why is it important? And most importantly, how is it different than IT? So this is really medical devices or facilities devices that are ultimately connected with your network. Why it's important that these are actually delineated is because they haven't gone through the traditional hardening that a lot of your IT devices have. And so there isn't the ability to actively scan those devices out of risk of tipping it over. You can't actively hit, for instance, your patient monitoring devices because it may interfere with critical information that's actually flowing into your electronic health record or even ensuring that nurses understand what's going on with patients. Chad, anything you want to add to that definition?
Yeah, absolutely. Whenever we talk about OT, we want to make sure everyone understands the broader scope, right? It's not just the operations technology that some people sometimes think of as like the HVAC systems that run a hospital. It's far broader than that. It can be anything from glucometers to IV pumps that are notoriously insecure. Heck, we even see unmanaged devices like Teslas connecting to a network, or Nintendos or gaming systems or TVs that sometimes fall into this category as well. So OT is a very, very wide range that as you're walking through a hospital, remember, it's not just Windows machines or non-Windows machines, it's all the technology that's out there and how we can protect it. So I'll hand it back to you, Dustin.
Thank you. So why do we care about this, right? We want to ensure that our environment of care is protected. Even I believe Herman Ed Amy was saying that cyber risk is likely going to be a part of Joint Commission standards in the future. And so we want to make sure that our patients are safe, but also there may be additional accreditation standards coming down the line in the future. We also want to ensure that all of our patients are satisfied. We do receive reimbursement related to PPQ and HCAP scores. I mean, this is going to be a portion of the way we get our Medicare and Medicaid money, and so we need to ensure that our patients are satisfied. And last, and probably the most important here, is really device availability and performance, ensuring that those devices are available within your organization and that you also never end up in a position where you're having to end up on divergence. So the challenges to addressing this. First and foremost, we want to make sure that our devices are secure before they get into our inventory. So really, do we have the appropriate compensating or mitigating controls in place to know that our devices can't do anything improper? For instance, do we still have the OEM credentials and that's how you log in? Is there an opportunity to change those so that someone walking in off the street with some medical device knowledge couldn't hack into your device and subsequently be within your network? Next, you also have potential risk of an incomplete inventory. One of the benefits IT has over operational technology, they can actively scan all those devices. And again, out of the risk of tipping over some of our medical devices, we can't do that. And so we're leveraging tools like Cynerio to assist us in this. Well, Cynerio may find different devices that are not in our inventory. And so there's the ability to enrich and ensure we have an accurate inventory based on that work that can ultimately be performed between Cynerio and Nuvolo. And then lastly, how do we respond to these threats? There's also kind of two different categories. You have really anomalous behavior. So what's going on kind of right here, right now, and what's different about a particular device's communication at this point in time. And then you also have vulnerabilities. And so how are we responding to these and then adequately ensuring we can get boots on the ground to deploy the fixes when necessary? Not all of our technicians are cybersecurity experts. So can we put this into a cohesive message that allows them to ultimately perform that fix? And in some cases, is there an opportunity to leverage our IT counterparts to ensure that if something needs to be done beyond the wall or even at the switch level, that that work can be performed quickly and efficiently? Chad, anything you would add to this?
Yeah, absolutely. One other thing I like to talk about whenever this area topic comes up is that healthcare environments are incredibly unique environments for a variety of reasons. They're focused not on profit, for example, they're focused on providing care. And so having products that have very specific healthcare focus, like Nuvolo, like Cynerio, allows for greater contextual knowledge analysis, et cetera, of the devices as well as the traffic that's coming from those devices. And as Dustin mentioned, as we see the entire healthcare cybersecurity landscape evolve, right, we're seeing attack vectors get broader, regulations are evolving, lots of different bills are going through, lots of different bodies right now. In things like cybersecurity standards change, we have to continue considering those unique aspects of the healthcare environments. And the overwhelming message we get when we work with customers is that availability is first and foremost the most important thing. Of course, they don't want to lose money. Of course, they don't want to get fines for things like a HIPAA violation. But at the end of the day, we are all working to make sure that in the most critical moments, these devices are available, they're operational, and that patients can be treated in a timely manner. So availability, operationability is by far the #1 thing that the Nuvolo team, as well as ours, strives to achieve. Back to you, Dustin.
Thank you. So Nuvolo's OT security platform and the work that we've performed with Cynerio, how does this all tie together? And also, how does this fit within the phases of a cybersecurity program surrounding your medical devices? Well, first and foremost, again, let's be proactive. Let's perform risk assessments. Let's understand what risks are potentially coming into our organization and see what we can do to get ahead of them. And that's where our risk assessment is going to really work towards those fixes and ensuring your asset onboarding process includes the steps necessary to keep your devices secure. Next, we have our inventory and workflow. And this is really combining the rich technical context from Cynerio into your device record where you have that operational context and being able to pass that information back and forth so that you have a better understanding of your inventory. And also, as mentioned before, there may be times where Cynerio is identifying devices that ultimately do not exist in your inventory yet. And we're enabling a device verification workflow to, again, make sure your inventory is complete. And then our last section is really monitoring and response. So when you do experience anomalous behavior on your network coming from a medical device, how do you respond? And then also, how are you tracking any of the vulnerabilities within your environment, and also whether or not you are choosing to either defer that risk or accept it, or are you actually putting in place controls? To better understand our risk assessment, it's thinking about the full asset lifecycle. And we're focusing on properly configured devices with the appropriate security posture and really an audit trail of the activities performed. How does this fit into a process, and what are we going to showcase within Nuvolo? This is where we're going to showcase our procedures for an evaluation. We're also going to talk about how we're looking at external documents or even our internal policies and procedures to understand how this ties into really Nuvolo, and then subsequently later on, Cynerio. How this applies to new and existing devices, and then also ensuring that we're including vendor recommended settings. So this is showcasing really before we have all of our connections to our device, let's make sure that we've put in place the appropriate posture. So what we have in front of us right here is a risk assessment on an MP5. As we're creating our risk assessment, we're really looking for what are some of our concerns about this device potentially being deployed in our environment, and then what are the appropriate configurations or controls I can put in place to really reduce the risk of that finding. And a lot of this information is going to be coming from, again, either your internal policies and procedures or even the MDS squared form. So even right here, I'm able to go through and look at certain information associated with, in this case, our care stream DRX, and I can start thinking through, what do I need to potentially change or may need adjusted before the device is actually put on our environment? A great example is here we have automatic log-offs, but we may need to go determine or put in place exactly what our configuration is for the idle time. And I can see here that this can be configured. So this is an example of one of those tasks that may need to be performed on that device in our MDS squared form, that DRX, before it was deployed. And so that could be very similar in nature to our findings and controls listed below. Once we have an understanding of any of the findings and corresponding controls, then I'm going to commit this to what we call a model security lifecycle profile. And this gives us visibility to any of the findings established before, also their reduction, and then I'm able to start laying out the tasks that I want to leverage in order to make sure those devices are safe. As I'm establishing these tasks, I'm also able to set up procedures. A procedure helps us understand in very, very simple steps exactly what work needs to be performed by a technician. This alleviates the need for every single one of your technicians to become a cybersecurity expert and allows them to focus on what they do best, which is really performing those PMs within the areas that they already work, maintaining those clinical relationships. And as Chad had alluded to earlier, I think the most important part is ensuring devices are up so that you can guarantee utilization and device availability. Once you've established the procedures that need to be leveraged in order to put in place your compensating controls, then you can associate these with specific tags. And once this is created, I can then generate my work orders, which go out to my boots on the ground. Again, going back to this idea that not everyone has to be a cybersecurity expert. And if your technicians are leveraging Nuvolo today, then it comes across as a work order in a format they're already comfortable with, but I have my access to the procedure steps written in such a way that even a BMET 1 is going to be able to ultimately perform the task that's needed. So again, we've really given a clear and concise way to enable technicians to go out and ensure that our devices are adequately protected before they're deployed into the environment. And furthermore, we can actually track whether or not these controls have been applied, how many of the devices have actually been remediated, and then also what our final score would be after deploying any of our controls. The only other thing I would add is, as you're going through and you're trying to think about which devices you want within your inventory, you can do this even before purchasing a model. So if you have some sort of a governance committee and you're establishing whether or not you move to a specific model standard, there's the ability to really perform an assessment while looking at the MDS squared form and understanding how rough would it be bringing in this new particular model, and is it worth the accommodation steps that we have to put in place before deploying it. So not only are you able to better secure your existing inventory, you're also able to better manage your procurement and standardization efforts. And that's a demonstration of our risk assessment. And now we're going to get back into really the better together story of Cynerio and Nuvolo. And this is where we start to talk through inventory and workflow. Right now, you may have a passive monitoring tool such as Cynerio, and you may have Nuvolo, but if they're not connected, then you may have differing information between the two sources. What we're doing is leveraging Nuvolo's intelligence hub within our OT security module to really take and consolidate that information to, again, give you that rich context and a complete inventory. To give a better understanding of what this looks like, we're going to step through some of the information within Nuvolo that is ultimately being enriched with that connection with Cynerio. I can see that I've had 5 different devices updated today, and that's the technical information that's updated. And so I'm able to understand where that value is coming in from that connection. And I can also start looking into which devices do I maybe need to incorporate a MAC address so that I'm able to gather and make those connections directly with Cynerio. Because at some point in time, we do need a match mechanism, and our serial numbers are not always going to be in the packet. As devices are coming into our inventory as well, I can start understanding where they're coming in and what departments they're associated with or what campuses, and then provide education to those groups as necessary to ensure they go through our traditional asset onboarding process. So again, I'm taking steps not only by understanding additional information through OT security and also Cynerio, but also establishing better business processes based on the information seen. A great example is at our Buenos Aires campus. That's where most of our unknown devices have come in for the last 12 months. Maybe there's an individual there that needs to be educated, or maybe I've got a clinician that unfortunately is always trying to circumvent the process. Alternatively, maybe I'm leveraging an organization like Agility and I need to have a better, we'll say, pump onboarding process for after hours before devices are connected to our network. Now, if I look at an individual device record, I can start to see some of the rich information that's actually coming over from Cynerio. I can see my operating system as it's coming in, what software version I'm on, what firmware version. And really, it's much deeper than that. To get a better understanding of kind of the breadth and how robust the work we're doing together is, there's over 96 different data elements. Well, there's exactly 96 different data elements that we're mapping right now to ensure that better together story. And so the question comes up on occasion, why would I need OT security when theoretically we could do this ourselves? Well, we want to give you a sustainable platform that we're performing the risk testing against, and we work directly with Cynerio to always ensure that our OT security solution works for you. Another element of focus when we think about really ensuring we have that complete inventory, we've talked about how at times there is the potential that Cynerio may find devices that don't exist in our inventory today. This is where we're able to produce a device verification work order so I can put boots on the ground with the information that's come from Cynerio and try to do some research to understand what this device actually is, and then whether or not it's a device that already exists in my inventory and I want to reconcile that, or if I need to go as far as creating a net new device. So the last element is really monitoring and response. And before we go into our monitoring and response, Chad, do you want to talk about some of the technical information coming from Cynerio and some of that value that's being incorporated onto the device record?
Yeah, I'd love to, and I'd love to kind of hit on a couple points you brought up and go a little bit deeper in them. First, one thing Dustin mentioned was passive analysis. And passive analysis is this really great form of technical analysis where we're able to look at copies of network traffic without interfering with network performance. And what that allows us to do, because all of these OT, IoT, IoMT, et cetera, devices are incredibly verbose, they're very chatty, they're sending packets, moment after moment. It allows us to analyze those packets with something called deep packet inspection, while also identifying where there's data we shouldn't be looking at, such as patient information. So we can really focus just on the technical components there. And what this means is we're able to identify not only those 96 elements that we can share with Nuvolo to better document your inventory, but we can identify where patches may need to be made and make sure that's analyzed. We can identify things like EPSS. EPSS is an exploit prediction scoring system based on open standards that allows us to not only to identify where there are known vulnerabilities, but also their likelihood of those being exploited in the wild. So when your IT team gives you a ticket of, hey, you have to patch X or Y or Z, you know it's coming based on not only the severity of that risk, but the likelihood of that risk being exploited as well. So it gives you this great combination of using known good configurations through MDS squared, as Dustin was mentioning, but also continuously monitoring for devices that need updates, or in the event of an attack, identifying network anomalies, reporting that, and then handling that with your security team. So the combination of Nuvolo's full system, which helps with onboarding and long-term maintenance, and our continued passive analysis allows for known best practices to be implemented and any unknown best practices that have to be implemented during an attack or some other malicious event to be handled rather quickly. One other thing, as Dustin was saying, with boots on the ground, because we're able to identify where devices last connected to, we can tell you the last Wi-Fi point they were at, so you don't have to search through a whole facility. You know, within a floor, or half a floor, or several rooms, roughly where that device is, which is incredibly valuable as well. So Dustin, I'll hand it back to you.
Yeah, no, that was an excellent segue, because you brought up the anomalous behavior and being able to get that work deployed quickly. And I think that's really what this last segment is about at the end of the day. It's really about triaging and workflow and efficient allocation of resources. I know I've hit on it a couple of times already, but the ability to have non-cybersecurity savvy technicians still performing cybersecurity work is immensely beneficial. I mean, you don't have to have that extreme technical expertise in order to be successful. And also having visibility of when I should ultimately push things to the other side of the house, or even at times, if you're leveraging a Cynerio and ICE integration, maybe there's certain work that doesn't need to be performed simply because an ACL change was performed really through ICE. So there's different opportunities. And as we think about our ways that we ultimately want to monitor and respond, let's focus on automated activities and how we can ultimately track and document throughout the life cycle of any anomalous behavior or even vulnerability management. So as I have my security management dashboard open, I'm really focusing on those active exploits or anomalous behavior. And then the other component is going to be vulnerability management. And as I'm thinking through this, you'll note even just now, I actually had a new event that hit our system. So I have that direct visibility as the information is coming in and ultimately being digested and even potentially applied directly to a work order. To understand how this may apply directly to a work order, let's go ahead and go look at what just came in. So Cynerio's identifying ultimately a particular issue that has occurred, and then based on the rules that I've set up during my OT security deployment, I literally had that go all the way to the technician level. And so if there's certain remediation steps that are described when a particular exploit is found, that could literally be sending boots on the ground immediately. And so that right there is immensely powerful in terms of the time savings that you didn't have to go out and understand exactly who is going to perform this work, because for all intents and purposes, that's Corey's MP5. That may be actually sitting up on West 8, and that's a unit that he's been working with for years. And so Corey may not be a cybersecurity expert, but he's familiar with the clinicians in that unit, and he knows exactly what they need, and he knows how to work on MP5s. And so having that level of automation where the information regarding the exploit comes straight through from Cynerio, you can have that mapped directly to the device because we've tied those together already. And then having your boots deployed as soon as it comes through, that's powerful when it comes to anomalous behavior and ensuring that you are back up and running and protected as quickly as possible. And so that's really, when we think about it, the anomalous behavior, security events, that's kind of our oh shit work orders, okay? Now let's get into the oh god work orders. So vulnerabilities are everywhere, okay? On a particular make or model, you could have up to 50 vulnerabilities. And what you're going to run into is at some point in time, we need to figure out how we're going to get the work performed. And then also, what are we not going to work on? So a lot of this information is going to come over from Cynerio. So we've got an understanding of our vulnerabilities, and this is going to tie back to our CVSS scores. So with this in mind, I may need to go through and look at certain vulnerabilities and actually rescore these. Is there something unique to my organization or even this specific device deployment where maybe the risks are not as high? Maybe the attack vector isn't even possible at the adjacent network level and someone needs to be local. So you have the ability to go through and modify your CVSS score so that you have a better understanding of exactly what needs to be focused on. And once you've gone through and kind of have an understanding of the particular vulnerabilities you want to hit, again, you've got options. You may create that work order and actually put some boots on the ground with your recommendations, or maybe you don't need to take action. Maybe I want to defer this, or I close it because it's not relevant to my specific inventory. So we're taking our massive list of vulnerabilities, again, going as far as saying you could have up to 50 for a very specific model. And we're starting to ultimately document the steps taken to either fix that, or again, we can even defer it. And upon deferment, I can have that notification and have this open back up to ensure that I'm able to go take the steps again. If we think about a lot of the vulnerabilities that exist today, how many of them do you have the information needed from the OEM to resolve this immediately? I would bet a good portion of them you do not. And so there is that need to still keep these out there because you're not able to fix it, but being able to defer it while you're performing your vendor research can be immensely beneficial. So we've talked through our anomalous behavior and how our OT security module in conjunction with Cynerio can expedite your ability to respond by sending things directly to a particular technician. And we've also briefly discussed vulnerability management as it relates to individual devices and being able to track your action. The one element that I would like to reiterate, and then we'll ultimately start kind of wrapping this up with some final words from Chad and then taking on questions as needed. All of this is facilitated by that device record. So having the enriched information is ultimately what allows us to have our vulnerability matches and then also our anomalous behavior matches, and then deploying those boots on the ground. So when we think about the phases of OT security, phase one, anything we can get ahead of, let's get ahead of it. And that was really our risk assessment process. So what controls can I put in place before a device is deployed? So this is kind of our proactive element. And then working with Cynerio, let's start thinking about how we enrich our device record. So what information am I able to pull in regards to kind of the technical status of a device? And then also which devices were not matched. And so I need to understand any of those devices I want to go perform verification work on. And then again, once we've created that complete inventory, I'm able to manage our anomalous behavior in a quick, efficient way, and also able to start triaging, rescoring, and then either resolving by putting in place controls or even certain security settings on our devices, or deferring to take care of those vulnerabilities. And with that, Chad, anything you want to add there?
Yeah, absolutely. You made a couple points. Again, I want to dive a little deeper on. First is when it comes to activities around managing risk, particularly in healthcare, it comes down to two main factors. One is resource allocation. Do you have the team, the time, the ability to actually fix the risks? And second is risk tolerance. So when you show the ability to defer maintenance, when you show the ability to accept a risk, those are sometimes completely valid ways to address risk. And at the end of the day, it comes down to, sometimes you accept something that's low risk, low likelihood, it's probably not going to lead to an issue. Other times you need to mitigate that risk. You need to put a Band-Aid on it. You mentioned the ACLs. Let's put network level protections that a patch can't be applied. And sometimes you do want a full remediation. You do want the full patch. So to this audience, I would just say, do know that there are different ways to address the security risks that you are seeing in healthcare. There is no one size fits all. And then as Dustin talked more and more, he started to hit on anomalous behavior. And that's something that, I think we all know. We're seeing more cyber attacks. We're seeing more ransomware attacks in healthcare. And just one little blip on the radar can tip us off to an attack that will happen in the future. The most interesting stat that I've seen recently is that most attacks take between 6 and 9 months to fully execute and recover from. Attackers don't just go in, find a vulnerability and attack. They sit there for weeks and months, collect multiple vulnerabilities before they attack. So finding those little needles in the haystack that point to something going sideways, something that just doesn't seem right, is incredibly valuable. And that's where we really start to complement Nuvolo, as Dustin was showing. When we see anomalous behavior, we're able to push an alert and get a patch fix very quickly. And sometimes this is short-term protections. Things like we have a product called ADR, Attack Detection and Response, where we're able to see malicious behavior. We're able to see ransomware executing. We're able to see malware trying to replicate itself on a network. And we can quickly quarantine and shut down those devices as needed. We're also able to do things like find exposed EPHI that is going outside walls that may not be getting caught by traditional IT systems. And we can also do things as simple as device utilization, right? May not be a security issue, but finding when you could take a device offline for maintenance is incredibly valuable as well. So we do have some of that immediate monitoring that's incredibly valuable. But Dustin also mentioned kind of the long-term practices of not just one ACL for one issue, but how do we actually put network segmentation in place so that we're properly segmenting all the devices to only the communication they need. So we can go in and do longer-term micro-segmentation projects. We can put vendor access controls in place. So a vendor that may have a dedicated line into your environment, that doesn't become a threat vector for you as well. And then, of course, long-term, we want to help you manage those vulnerabilities and prioritize. Just knowing that you have a bunch of vulnerabilities is not enough. You have to prioritize for your team. So at the end of the day, we love to continue seeing everyone work through Nuvolo and then enriching that data and allowing near immediate action when there are anomalies that have been detected. Dustin, I'll hand it back to you.
Yeah, thank you. I think that was ultimately an excellent way to kind of tie it all back together. So again, thank you everyone. And Linda, what questions have we got?
Okay, yes, we have got a couple of questions. The first question is, our team has been using our CMMS for 4 to 5 years and had some good initial luck. Unfortunately, we've seen data quality decrease over time due to the manual nature of entering data. What would you recommend to get us back on track?
Yeah, definitely. I think knowing that we are able to leverage really the technical information, and also depending on how you feel about the way the naming conventions are occurring within Cynerio, you can even leverage the information they're pulling over, and we can map that directly to specific values within Nuvolo. So we're able to enrich that data over time and clean it up as a byproduct of our OT security module. Great question.
Okay, another one coming up. How long does it typically take to extend the HTM-focused functionality in a CMS to include better security practices?
Yeah, and I think this is kind of a two-part kind of response, because there's absolutely the benefit that you would want to take on from Cynerio. So I'll let Chad take that. But I would say after you've kind of got Cynerio up and running and you've got an understanding of how it works and you're really taking on a good portion of that value, then from there, really we can get OT security deployed depending on kind of your needs. I would say it's somewhere between 8 and 12 weeks tops.
Yeah, and I'll jump on the first part of that. So, when it comes to deploying the security components that Cynerio offers, every environment's a little bit different with its own challenges, but we typically deploy our technology in a matter of days to maybe a couple of weeks to get it put on site. It's a rather quick process. From there, we have two stages of rollout. One are those immediate protections to monitor network traffic in a non-intrusive way through passive analysis. Those start immediately. So what we often find when we go into customers is that we'll be installed, and within a day or two, we'll have identified 2 or 3 pieces of malware, often very old, often malware that's 15 or 20 years old that has slipped past more modern technology, is trying to replicate without much success within a network. And we've seen results from that ranging from stopping the replication to actually speeding up the network because it's eating up all the bandwidth there. So the immediate findings that we see through our ADR product are incredibly valuable. Longer term, as we start to understand network traffic, what devices are communicating where, what the proper device communication channels are, we typically see in roughly 4 to 6 weeks that we have a rather comprehensive network map, as well as auto-generated network policies that you can put in place for things like microsegmentation projects that I mentioned earlier. If you're unfamiliar with microsegmentation, effectively think of it as, instead of allowing all devices to communicate with all others, only allow communication channels where they should exist and block everything else. So that all occurs, again, rather quickly. Within a month, maybe a little bit more, we have a very, very in-depth, detailed set of recommendations there. And of course, we continually monitor and update those. In terms of integration with Nuvolo, we have fully functioning integration. We've worked with each other before, so integrating the two components once they are deployed on site is relatively trivial. So that's the easiest part of all of this.
Okay, great, thanks. Next question is, our team refers to themselves as the unders, understaffed, underfunded, underwater. Beyond magically finding new funding, are there any realistic steps we can take to improve our situation?
I'll jump on that one first. The biggest thing that I encourage people to do is take advantage of your vendors, and not in a bad way, but talk to your vendors, see where educational opportunities exist, see where they've rolled out something in a similar situation that may match your organization. What you'll find more and more frequently is that if you can show value in what you're doing, funding can appear in some cases. So absolutely talk to your vendors, understand how your situation compares to others that they've dealt with before. And I think more often than not, they're going to find a way to work with you and make sure that you can kind of operate to the standards of today. Dustin, anything to add to that?
Yeah, absolutely. I think if you think about what Chad and I have talked about today, one of the big elements that's been brought up multiple times is appropriate resource allocation and being able to do more with less from kind of an education stance. So what I mean when I say that is, again, being able to leverage those less savvy technicians that don't have the cybersecurity training, giving them the tools that enable that is critical, because unfortunately, you're not going to be able to likely get the dollars to get everybody certified in regards to certain kind of cybersecurity practices. And so you're going to want to find alternative means to make that work. And I think that's one of the biggest elements of our Better Together story, is being able to do more with less. And so I wholeheartedly agree with everything Chad said. And I think the resource allocation component, and then also, like, again, which Chad alluded to, being able to showcase the value. Like, if you can articulate how this benefits your organization, I think that's what justifies the dollars, even in times like this where we're all facing hardship.
Yeah, and I do want to add one more thing to that, which is the unfortunate truth is not every healthcare facility can build out a full cybersecurity team. It's expensive. There's not a lot of cybersecurity pros out there, et cetera. So what you'll find with a lot of vendors is they also have folks like customer success managers or technical account managers who are responsible for making sure that you have the right resources to enable your in-place team to the degree they need to be enabled to be cybersecurity savvy. And again, whether that's training, whether it's giving you additional resources or supporting your resources in some kind of unusual way, most vendors have a team that can help supplement that cybersecurity shortage. So always make sure to ask about that when you are working with different products.
Okay, we've got a few more questions coming. The first one is, are the CVEs mapped to MITRE frameworks?
Yep, absolutely.
Yes.
We standardize everything, as does Nuvolo. There is no room to go and make your own framework at this point. So everything is mapped to industry standards.
Okay, what we got here? When speaking of the SLP / MLP, historically speaking, what function, department or teams are manually and when decided configures the risk inputs?
Yeah, no, excellent question. It really is. So what you have is, we have a many-to-many table where you're defining those risks and then the controls, and then you'll ultimately have the reduction scores. So there's kind of one of two ways to get that established. Either during your deployment, we could have a conversation and see if we can try and get that information from someone else, or you leverage your own. And that's an organizational choice that's typically figured out during deployment. And I think a lot of it comes down to how your risk assessments are performed today and who's performing them, because at times it may be supply chain, at times it may be IT, at other times it's HCM. And I think in our most successful organizations that we've worked with, it's really a combination of all three of those groups. And so the naming conventions and the setup, there's one of two routes you can go. We could either work together and try and gather that information from other parties and kind of help you talk through how they've leveraged it in the past, or you can set your own.
Okay, another question here is, I work for the Department of Health Services. Is it possible to integrate into our existing CMMS, which is EQ2?
Yeah, the Nuvolo portion, unfortunately, it's not. It is truly built on top of our connected workplace. But if you want, we can send you an email afterwards and have kind of a further discussion about potential opportunities of ways to kind of manage that. And Chad, if you want to add anything.
Yeah, sorry, I stepped on you there. Yes, there is opportunity to integrate there. Again, depends on your deployment model, but typically it's either through an API. We can also deploy through other custom ways if needed. So there is opportunity to integrate with Cynerio there for sure.
Okay, another actually question from the same attendee. So is the software built in IDS, IPS?
Yeah, intrusion detection and intrusion prevention. We border on that. So those traditional systems are often focused on more Windows-based technology, not always, right? There's others that are focused on. What we're finding is that more and more of those systems are missing certain kinds of traffic that introduce more risk to healthcare. So we are not currently built into IDS or IPS. We complement them incredibly well and work alongside them quite frequently.
Okay, a last question from the same guy. He said, what about SIEM?
Yeah, for our stuff, we integrate with SIEM solutions and are able to put data in there. So again, we have a full platform that we can display the information on. If you have a SIM or something similar deployed, we can certainly integrate with that and provide rich data about what we're seeing as well. And if that person wants to reach out to me directly, chad.holmes@cynerio.com, and we can dive much, much deeper into the tech components. And of course, if anyone wants to reach out to me, you can reach me there.
Great, thank you. Do you want to repeat that again, Chad, just in case they didn't catch that?
Yeah, absolutely. Chad.holmes@cynerio.com. You can also Google me, it'll pop up pretty easily.
Okay, great. Okay, well, we're coming up to our hour. So thank you, Chad and Dustin, for your time today and for a great and really informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our industry. So visit goames.com. As promised, the answer to today's trivia question is chlorophyll. So congratulations to our winner, McKenna Mason. Your t-shirt will be mailed. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. Thank you once again for joining us this afternoon. Enjoy the rest of your day, and we'll see you next week.
Thank you, everyone.
Thank you.